What is the National Diabetes Prevention Program and how can pharmacists bill for it? Find out next. Hi, I'm Blair Thielmeyer, and I work with pharmacists who want to build and grow their clinical consulting services. Today, I want to talk to you about the National Diabetes Prevention Program. So this initiative has actually been around for several years, but only since 2016 has it been billable through Medicare. So the one thing that we always want to remember to go back to is that the Diabetes Prevention Program has to be part of a curriculum that is approved by the CDC. So with the Diabetes Prevention Program, everything goes back to the CDC. Our ability to bill, our ability to get our curriculum approved, and who they view as recognized providers. So the G code that you're going to be billing under, there's several different ones. They range from the G code 9873 to 9885. So those G codes are group sessions, they're individual sessions, they're different. Like one of them is 9% weight loss from baseline achieved. So you could bill for that G code if the patient was doing really well. So the minimum of these programs is 1 year. What you need to remember about being a provider, you have to become a provider through the CDC. You have to go through a CDC approved training curriculum. It can't just be a lifestyle coaching, it has to be a CDC approved lifestyle training. Those you can do them online, in person. They range between $500 to $1,000 for that training in the program, and the training has to be recognized to prevent or delay the onset of type 2 diabetes. So of course there's many lifestyle modification or health coaching programs that can help a patient avoid or delay the onset of type 2 diabetes, but really making sure that you have a CDC approved curriculum and are a CDC recognized provider of this, and that you're following their program. So the guidelines say the program has to be a minimum of 1 year in duration. It may be up to 2 years with at least 16 sessions in the first 6 months. Those sessions are typically in the group setting, but they can be done online, they can be done in person through distance learning, or a combination of the three. So if you start out with a group or a one-on-one in person, it doesn't necessarily have to stay that way. They can move to telehealth or whatever's best for the patients. The program does have to have the ability to track the patient's progress. So you must be able to track their physical activity or their weight or whatever the metric is you're looking at, A1C I guess even, and report it back to the CDC to maintain your recognition status. So how can a clinical consultant pharmacist use this? Well, once you get enrolled with the CDC, the sky is the limit. So you can actually do this in a retail setting, in a group class. You could start a class in your community or develop online content for it. You could work with a local physician's office to help see their patients, maybe doing even referrals one-on-one. The main thing is, of course, meeting the CDC criteria and being able to track those outcomes. So then, how would billing work? I guess it really depends on your setting. If you're going to be in the community setting, you're probably going to be billing through a 1500 form or some type of super bill. Whereas if you're working, say, in an ambulatory care clinic type setting, you're probably going to be billing through their medical care billing. So that's the Diabetes Prevention Program. I think it also works really well with the Remote Patient Care Monitoring Program, which we're going to talk about in our next video. If this video was helpful to you, please consider subscribing to our YouTube channel and sharing it with a colleague. And if you'd like more information about pharmacist-led consulting services, join the Pharmapreneur Community Newsletter. We're at btpharmacyconsulting.com/newsletter.